Epidemiology is the basic science that underpins public health. There are two major components to it. One is a descriptive component in which we describe the distribution of diseases across human populations around the world and in individual communities. And the second component is where we look to see whether or not there's a relationship between a particular factor, a dietary component or an exposure that a person has in the workplace, and the occurrence of disease.
The other thing that you must do is to have a list of hypotheses that we are testing in this data listed in advance of any data collection.
It can tell us many things, but probably the most important one is firstly whether or not a particular agent causes disease or can prevent disease, and secondly, how much causation, how much disease do you get as a result of a particular amount of exposure, or how much protection, prevention of disease do you get from a particular amount of exposure to that agent. Well, it's fairly easy to determine whether in any particular set of data there's an association between a particular agent and a disease. But that doesn't necessarily mean that the disease has been caused by that agent, and that's called confounding, and we have to take control of that confounding when we do observational epidemiological studies to be sure that we're getting the right answer when we make decisions about cause and effect.
There's a first smaller section which talks about PFAS investigation and management areas, and that's really hoping just to categorise people by town and those sorts of things.
And similarly, there are some aspects of design of epidemiological studies that can, because of non-response or the way in which the participants were selected, can create a bias that will produce an association that is not in fact a real association. It's due to the bias, and so we have to then check all the possible biases and decide whether logically any one of them can explain the association we see before we say we think that association might actually be causation and not just association. We've also got some information on levels of PFAS in people's blood, and we can actually see how that relates. So the more evidence that we can get from different directions that are all pointing in the same direction, the more likely it is we can make the decision, this is causation, not just association.